this lesson, I'm going to be explaining ectopic pregnancy, how it occurs, what it all means, and then your role for caring for this patient. So an ectopic pregnancy means a pregnancy that occurs outside of the uterus, okay? So it's not in the right place, it's outside. So let's get this straight. We are talking about an embryo that attaches on the outside of the uterus or in the wrong place. So you can see in this picture, these little white circles here are going to be the eggs and where they attach, or the embryo. This is a normal pregnancy versus an ectopic. So in a normal pregnancy, we're implanted here in the uterus, which is where it should be, versus here, all these different places. So within the fallopian tube, down in the cervix or the interstitial tissue, but not in the uterus where it should be. So that is the wrong place. This is dangerous because the fallopian tubes are not very big. So as you see here, as they start to rapidly divide like cells do and grow, we could have a tubal rupture. Our patient is going to be still having presumptive signs of pregnancy. She'll probably have had, a positive urine test. She might be nauseous, fatigued, all of that. She's going to have those presumptive signs of pregnancy still, because she was not going to be aware that it's ectopic until a little bit later on. This can be an emergency because it's usually not detected until there is a problem. So what do I mean by a problem? Well, we have that fallopian tube, like I said before, and it's a small space. So we have rapidly dividing cells that are going to grow and get bigger and bigger. Eventually something has to give, and the fallopian tube can't really give. It can't stretch. So it's going to rupture, cause severe pain. The hope is that when the pain starts, the female will seek medical help, and then they can preserve the tube as best they can before it ruptures. Our classic signs, like talking about the symptoms here. So our classic signs of an ectopic pregnancy start with just basic pregnancy symptoms. We have a missed period, the positive pregnancy test. So those presumptive signs of pregnancy. This is going to be followed by some spotting that occurs usually around week 5 to 6 and severe abdominal pain. Remember, it's in the wrong place. If it is not caught in time, the fallopian tube could rupture. So our last little symptom here, ruptured fallopian tube. This is going to be a true emergency. The patient's going to be bleeding into the abdomen. So there will be signs of shock. She also might have some referred pain. Referred pain is going to be usually felt in the shoulders and is due to the blood that's happening in the abdomen. In this picture, you can see the uterus is marked here with the blue arrows, and in the left fallopian tube. So here's our fallopian tube. So you can see the difference in size here. The red arrows are pointing to that growing fallopian tube. There's swelling and bleeding inside of it. So you can see how much bigger this left-sided one is compared to the right. It really looks like it's going to give and rupture. So what are we going to do for this patient? Our therapeutic management is going to be based around, the main goal is going to be to prevent rupture and preserve that fallopian tube. We want to prevent or minimize bleeding. And that will help to prevent shock. So these are all our goals. We want to prevent rupture of the fallopian tube, decrease bleeding, and prevent shock from happening. Management could also include surgical removal. So they need to remove that pregnancy, remove that tube. So either laparoscopic would be the hope, and that would require, not require a small or a large incision. The laparotomy is going to be the large incision, to get into get the fallopian tube. Medical management is going to be with methotrexate. So this is our medication that's given, usually given IM. And this medication is going to inhibit that rapid cell division that's occurring. Remember that embryo is a ball of rapidly dividing cells. So if we can stop it, that'll be helpful. It'll cause the baby to then abort, or the body, to abort the embryo. So this will cause a medical abortion. And hopefully that can help save the fallopian tube. It is very important that our management of this patient include RhoGAM if it's needed. So for our Rh negative moms, that they get RhoGAM, and that will help protect her in any future pregnancies, protect her body from attacking the fetus, just for blood incompatibility. So if mom has a Rh negative, she needs to be given Rogan. What education does this patient need? Well, she's going to need to report any severe abdominal pain that she's feeling. Of course, any right shoulder pain, because do you remember what that was a sign of? Rupture, and that is referred pain. We need to report any vaginal bleeding that's happening, even just some slight spotting, because it could mean that there's a problem in the fallopian tube, that we have that ectopic pregnancy. So she needs to report that. And then we need to explain the terminations. So some patients, they don't understand. They've had that positive pregnancy test and they don't understand why they need to get rid of the pregnancy. So we need to explain, why isn't it viable? That embryo can't grow in that small space or in the wrong space. Our nursing concepts for ectopic pregnancy are going to be reproduction, comfort, and coping. Obviously, the patient has reproduced, and then we need to provide comfort for her. She's in pain, having the severe pain, undergoing surgery, and then coping, because this is a loss. It is a pregnancy loss, so we need to provide coping for her. So let's look at some key points just to bring it all together and hook it all in. So it is an ectopic pregnancy is outside of the uterus. It's not in the right place, okay? The patient is going to have a missed period and probably some presumptive pregnancy signs. She will have a positive pregnancy test because the body thinks she's pregnant and is attempting to make it viable. She's going to have pain and spotting. So this is going to happen because we're in the wrong location. So she's going to feel that pain and have that spotting as that embryo starts to grow, and that it has to be terminated either medically with methotrexate or surgical removal, laparoscopically or laparotomy. Make sure you check out the resources that are attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.